Hello, everyone. Thank you for joining us today for this Arizona Department of Health Services Arizona COVID-19 Response webinar for health plans. We really appreciate everyone taking time out of their day to join us and get some up-to-date information. What we'll do first is we'll just go around the room and let you know who is present here on our side at ADHS. I'll introduce myself. My name is Eugene LeVar. I'm the Bureau Chief for Epidemiology and Disease Control.
Hi, I'm Shane Brady. I'm the Deputy State Epidemiologist.
Susan Robinson. I'm the manager of the Vaccine Preventable Disease Group here.
Hi, I'm Rosa Lira. I'm a preparedness field assigning.
Great. So what we're going to do is we'll go ahead and get started today to make good use of your time. And what I'm going to do is I'm going to pass this over to Susan Robinson so she can go ahead. Oh, sorry, I'm going to pass it over to Shane Brady, our Deputy State Epi, so he can go ahead and get started with the presentation.
All right. Welcome, everyone. So today we're going to talk about the COVID response, talk about the outbreak to date, the response in Arizona, how you can prepare, what you can do, and then try to answer any questions. So the way we're going to do questions today is writing in the chat box. So if you have any questions throughout, please type them in the chat box, and we'll also have a time at the end for typing in the chat box, and we'll do, again, our best to respond to as many questions as possible. All right, so in December, China identified a number of clusters of patients with pneumonia of an unknown cause that were epidemiologically linked to a seafood and wet animal wholesale market in Wuhan, Hubei province, China. And the initial report suggested that there was animal-to-person spread. However, with a growing number of patients without exposure to animal markets, person-to-person spread was suspected. So in January, the cause was identified as a new coronavirus, and by the end of January, there were over 9,000 cases globally. And airport screening was initiated in the U.S., and the first case of novel coronavirus was detected in the U.S. on January 21st in Washington. On January 26th, the first infection was identified in Arizona and was reported in an adult living in Maricopa County with recent travel to Wuhan, China. In Maricopa County, Arizona Department of Health Services and CDC coordinated that local response, which included case contact identification, classification of potential cases, and arrangement of testing with CDC. And so the U.S. or WHO officially named the virus COVID-19 in February of 2020, and by the end of February, there were 51 countries with cases and over 80,000 cases identified. And the U.S. had their first possible community spread case of COVID-19. So as you can see from this map, the WHO has been posting on a daily basis situational reports and reporting out which countries have been affected, how many cases, and I believe as of today, there's been over 70 countries that have been identified, and as you can see, this thing is spreading across the globe. So next we're going to talk about what is COVID-19 and talk about the virus. So COVID-19 is caused by a novel coronavirus called SARS-CoV-2. And coronaviruses are a large group of viruses. There are several known coronaviruses that infect people, and they usually only cause mild respiratory disease such as the common cold. And coronaviruses can be found in animals, and some of these viruses have the capability of transmitting between animals and humans or from person to person. So what do we know about COVID-19? Well, we know there's a wide range of symptoms from mild to severe, and that symptoms can include fever, cough, and difficulty breathing. And, you know, this is just on a side note, this looks very similar to many other viral respiratory illnesses, such as influenza. So information so far suggests that most COVID-19 illness is mild. A report from China suggests that serious illness occurs in about 16% of cases. And really what we're seeing is older people and people with underlying health conditions like heart disease, lung disease, and diabetes are really at more risk for serious outcomes compared to otherwise younger, healthier people. This virus is thought to spread person to person via respiratory droplets that are produced when someone infected with the virus coughs or sneezes. And there's currently no medication to treat it or vaccine to prevent, although there are researchers working on development of both of those. However, right now, we can all take everyday measures, including proper hand washing, covering coughs and sneezes, and staying home when we're sick. So just kind of talking about the public health strategy in this, we initially started off really trying to contain the virus at the source, and we saw that with some of the airport screening and the efforts in China. And it looks like it's moving now towards more of this community mitigation and preparedness response. So in the early stages of an outbreak like COVID-19, public health takes measures to contain diseases to stop them from spreading in our communities. So for example, in Arizona, local public health partners have been monitoring travelers returning from China for symptoms of COVID-19 and ensuring that individuals suspected of being infected were isolated until their test results came back negative. So when we move on to kind of more of a mitigation process, given the national updates, it's clear that there's a higher likelihood of community-wide spread within the United States. So the public health measures begin to shift to slow the spread of the virus rather than contain it at its source. So, for example, as additional community cases are identified, it may be no longer feasible to isolate affected individuals and quarantine their contacts. Instead, public health may begin working with community and business leaders to really encourage social distancing. So really, what can you do to prepare your plan holders? So for plan holder messaging, we think it's important to recommend that people not wear a face mask to protect themselves from respiratory diseases, including COVID-19. That's not a CDC recommendation, but we do want to make sure that we're ensuring supplies such as tissues and hand sanitizers are well maintained and placed in multiple locations for ease of access. Another important component is that we want to make sure we're staying home when we're sick, and that we're covering our coughs and sneezes with a tissue or an elbow. And of course, one of the most important things is washing our hands often with soap and water for at least 20 seconds. And we want to encourage staff and plan holders to get their seasonal influenza vaccine as well. So for plan holder messaging, really, we want to focus on, have there been any public health messaging sent to beneficiaries before? What kind of strategies can we utilize for public health messaging, text messages, emails, phone calls? And do you have a pandemic plan for influenza that could be utilized and adapted to the COVID-19 response? And again, most patients will not need to be admitted to healthcare for COVID-19 symptoms. So on that note, kind of want to talk about telemedicine. So healthcare facilities can choose to increase the use of telephone management, other remote methods of triaging to increase their surge capacities. And really messaging beneficiaries to promote the availability of covered telehealth, telemedicine, or nurse advice line services is something we're recommending. And really what we're trying to do here is decrease the potential exposure at healthcare facilities if it's non-critical. So the messaging is really for those people who don't have severe enough symptoms to seek healthcare, that we prefer they do some other alternative form of care like these telemedicine options. So we just wanted to share some additional resources. And again, this presentation will be posted. So those resources will be available through those hyperlinks here. But we do have our website, which has, the most up-to-date information that we have available on coronavirus. The CDC website is also listed as a resource, which will have the most up-to-date information as well. And then we also have our own azdhs.gov non-pharmaceutical interventions plan posted. There's CDC business guidance, and then also CDC prevention and treatment guidance. So just in general, if you have any questions about how to prepare for COVID-19, the best point of contact is really your local health department for that planning component. All right, and we can move on to questions now. And so if you could please, again, type those into the chat, we will do our best to address as many of the questions as possible. So it sounds like someone's saying there was a sharing content issue, not able to see the slides. Was that for everyone or just the person who sent the question?
Okay.
Okay.
Okay, so we've got a question about where people are being tested and where testing is available. So currently right now, testing for COVID-19 is only available through CDC, Center of Disease Control Prevention, and our state lab here, the Arizona State Public Health Laboratory. So currently it is not available from a commercial lab at this time, and there are, that is something that is in the works though. So at the current moment, it's only through public health, but I think we'll see that situation kind of evolve as we go.
Hi, everyone. There's a question. Is there a recommendation for what products to use to clean with? I will let you know that EPA has come up with a list that has useful products to use against SARS-CoV. Just to give everybody a little bit of a hack, you can go to Google and just search EPA list N, and it'll take you directly to that resource that you can click on and see what products are available and have been approved to use for SARS-CoV-2.
So we've got a question here of, do you have any recommendations for employees who personally travel outside the U.S.? Should they work from home for 2 weeks? And so I think that there's certainly some concern about those traveling, especially to areas that might be currently affected with COVID-19. I think something to consider if telework is an option, is potentially a great option. I would suggest, though, that you, if you have concerns for a specific employee, that you coordinate with local public health. I think if, you know, there's lots of considerations around that.
So we have a question about what the local health department is. So each of the 15 counties in Arizona do have a local health department, and they are really kind of the boots on the ground response to public health activities like COVID-19. So they're really the ones that coordinate those on the ground efforts. And so we have that contact list posted in the slides that will be posted as well as on our website.
We've got a question. Has a second case of COVID-19 been identified in Arizona? And the answer is yes. And we are doing our best on a daily basis to keep our website updated with our current numbers of cases.
So we got a question. The death rate was recently increased. Do you think this is an accurate increase related to lower testing, only getting rates for more serious cases? Yeah, I think from some of the data that's come out of China that we've seen, really they've shown mostly that it's a mild illness. And with the mortality rate, that definitely can play a role, like you mentioned, the number of people being tested and who's being tested. So that will evolve over time to really get a true rate of it. But there was a recent paper published yesterday that talked about a cruise ship with individuals on it, and over half of the individuals who were tested positive actually didn't have any symptoms. And there were 6 deaths on that. So it's definitely going to be an evolving situation with that number.
We've got a question. Is there any evidence of spread other than person to person, such as maybe touching infected surfaces? So we do think that the way that this is transmitted is via droplets. And so person to person is one version of that, but certainly we do think that it's a possibility that, you know, if you come in contact with an item that has had those infected droplets on it, there's a possibility of that. It's, you know, like Shana just mentioned, this is constantly evolving, but that potentially would be a way that this could be transmitted.
And again, going back to what Susan was talking about, the hand washing is just critical to make sure that when we're touching items, washing our hands constantly, or using hand sanitizer if you don't have that available, 60% alcohol base.
Our next question is whether Arizona has a stockpile of supplies like ventilators, respirators, masks, oximeters that will be available to the public for testing purposes. We do not have a large stockpile of supplies for that purpose. At this time, we have a small number of supplies that we work to get out to local health departments, but we're waiting to determine if the federal government will release a stockpile that might have additional supplies in it.
There's a question, is it true that there was a vaccination given to people in China in December, which was prior knowledge of this outbreak? You know, we're not sure of that. And, you know, it's unclear on some of the efforts in China as well, so don't have any answer for that one.
So there's a question about if someone is diagnosed and subsequently recovers, can they be reinfected with COVID-19? So unfortunately, I think that, you know, because this is new, we don't have a lot of information around this. I think this is one of the questions that's going to be being worked on as the situation continues to evolve. So I don't know that we've got that answer right at this moment.
So do we know how long the virus is active on surfaces? We don't know. There hasn't been any evidence-based studies to kind of determine that. Again, I think we know that other coronaviruses can be transmitted via surfaces, so we do recommend cleaning surfaces, especially high-touch areas, regularly. And again, it's going back to washing your hands and not touching your face or mouth.
And also good environmental cleaning practices, making sure you're cleaning those high-touch surfaces as you normally would and regularly would with appropriate cleaners.
Questions about whether the webinars will be available after this week. So yes, we are recording these and we'll be making them available on our website. Can you confirm again if the testing capability available at the state lab and how many people have been tested for the virus so far? So we have those numbers on our website as far as how many people have been tested. I unfortunately don't have those right in front of me, but they are available for that. And yes, we currently have testing capabilities here at our state lab, and Eugene was able to pull that up for me, which is excellent. We have tested, we have tested 34 people at our state lab so far, or tested individuals for COVID-19 in Arizona so far. So it's more accurate.
So are all sites able to test? Is the test probably available? We're wondering about what code MDs might bill for this and ensure to use the right reimbursement. So again, the tests are only available at public health laboratories, including CDC and the Arizona Department of Health Services. So that wouldn't be something that would be billed for because it would be done by public health. And that would be coordinated again through the local health department to ensure that the patient met the criteria for testing.
Next question is, since this is like the common cold, what should we recommend to our members to do if they are concerned about their symptoms? And so this is a great question. So I think, like we said early in the presentation, you know, we're really sort of shifting from containment to sort of more of a mitigation strategy. And I think part of that is for people to understand that, you know, if they have symptoms that are similar and they don't need, you know, immediate medical care, that we want them to stay at home, and we want them to try to limit the amount of exposure they're having to other people. We want them to follow some great hand washing and, you know, cough hygiene practices. And so I think that's really what our recommendation would be. Shane talked a little bit about the telemedicine option, and that might be great too. if they want to be able to discuss with a doctor kind of what's going on and what their symptoms look like without having, you know, possible exposures happening. Telemedicine might be another great option if that's available via your plan. But we really want, you know, unless people need to seek medical care, you know, really kind of staying at home, treating their symptoms, and waiting for that resolve to happen. Oh, this is a great question.
Sure, I can fill that. Why is the most recent case in Arizona listed as presumptive instead of confirmed positive? So all the tests that are performed outside of CDC at the other public health laboratories, including Arizona Department of Health Services, are considered presumptive until confirmed at CDC. And again, this is an evolving situation, and that may change over time. So I think for, there's another question that says, is there anything you would recommend for workplaces such as water, utilities, and customer service roles, and roles where employees are interacting with various customers beyond hand washing and keeping the environment clean? I think the biggest things are really, you know, like you said, hand washing, keeping the environment clean, staying at home when they're sick, and really, if there are options for, you know, teleworking or other kind of ways for them to kind of do social distancing, that's a preferred method.
We've got a question about how much testing is going to cost, and I think since we only have it at our public health laboratories right now, we don't know the answer to this question, and I think we'll be learning more as testing becomes more widely available.
Should we avoid crowded areas, sporting events, large gatherings as much as possible, or is this an overreaction? So CDC has put on some of their web pages kind of suggestions to consider canceling large mass gatherings, or just to consider kind of changing the way that some of these mass gatherings occur to kind of try to limit interaction. So maybe not shaking hands instead, you know, not doing those kind of things where we're getting close to each other in our personal space, and really, again, pushing on the hand washing and social distancing, I think. So I think that is something that you could consider.
We've got a question about whether the health department is going to make recommendations for employers and schools if and when they think they should engage plans that would have more employees working from home as able. And I think that, you know, from our perspective, we're saying go ahead and start thinking about these. Start making plans and figuring out what that looks like for your own organization, and having these conversations and knowing that you've got all of the documents and all the plans ready to go. You know, I don't know if there's any more.
Sure, and just to kind of piggyback off that, we do have a webinar later this afternoon that's specifically for child care in schools that we'll be hosting. And if you go to that first resource that's listed on our resources here, there is a school and also university page that is live now that has information and recommendations and also resources for those particular entities.
So how have Arizona medical hospital facilities prepared if an epidemic occurs? What measures, trainings, et cetera, have occurred? So we can talk, we're going to be doing some healthcare trainings this week, some webinars as well. And we know that many of the hospitals and facilities have been keeping up to date with recommendations. We've been sending them recommendations from CDC, and there are, you know, preparedness coordinators at many of the facilities trying to implement these plans. And I'll turn it over.
Yeah, this is Kathy McKenna for a healthcare institution licensing. And all of our licensed medical hospitals and facilities are required and have been required for greater than 5 years now to have what they call emergency preparedness plans in place. And they have to be exercising these plans Of course, the scenarios are different. However, they do have the infrastructures, they do have the communication systems, and they have exercised how care would be delivered depending on different scenarios that they have exercised over the last several years. So they are prepared. We are also working with them to make sure that that they are, if they are over capacity, we've given them some relief on how they can also care for patients outside of their main hospital building.
Great, thank you. So we've got a question about how often cleaning is being recommended and if there are any cleaning guidelines posted anywhere. So yeah, Eugene.
Sure, just to let everybody know, there is the CDC business link, which I believe is the 4th bullet on our resource webpage there, that does take you to some guidance that is titled Interim Guidance for Businesses and Employers to Plan and Respond to COVID-19. This was recently updated in February 2020. And within that guidance, they do give some recommendations for routine environmental cleaning. And just to kind of go over that with everyone on what's listed there, routinely clean all frequently touched surfaces in the workplace, such as workstations, countertops, and doorknobs, which is a message that you heard earlier. Use cleaning agents that are usually used in these areas and follow the directions on the label, which is very important. There can be differing recommendations for contact time, how long you leave that cleaner on the surface, from different disinfectants and cleaners that you use. So you want to pay close attention to what are those instructions for those cleaners. CDC does not recommend any additional disinfection beyond routine cleaning at this time. And they also state in here to provide disposable wipes so that commonly used surfaces, such as those that were named, can be wiped down by employees before each use. So those are some recommendations that I think you can take back as a business and try to see what you can do to implement some of those moving forward.
Great, we've got a question about the criteria to determine who gets testing.
Yeah, so the criteria for testing, incidentally, actually, was just updated today. So it's kind of pending this new criteria. So we do have staff on the phone with CC and other organizations kind of working through what that process is going to look like now that they've changed their criteria. So we'll keep everyone posted on that.
Look for updates.
So what kind of surveillance activities are public health agencies engaged in given the high transmissibility? You know, there are a number of different surveillance activities we're doing. So again, we do monitor like flu and other respiratory viruses through kind of syndromic surveillance. So looking at symptoms to kind of see if we're seeing any changes. And seeing if we can identify any individuals who might be flagged. But again, a lot of this really relies on clinician suspicion and the astute clinician to really identify these individuals and make sure they're reporting it to their local health department.
There's a question here, in a healthcare setting, should a suspected case be placed in respiratory isolation room? And just to let you know, we recently updated and distributed guidance as of this morning to our healthcare partners and public health partners to let them know that they're in Arizona. We did make a change for our recommendation, and that did change to individuals can be placed in a private room with the door closed. So in Arizona, that recommendation for airborne isolation is not being made for those suspect or confirmed cases of COVID-19. Except for specific procedures such as aerosolizing procedures, when those are performed, that is a general recommendation to go ahead and have those done in those airborne isolation rooms.
Let's see.
So the next question is, how will health plans be notified when our members are either diagnosed as positive or in quarantine status? We currently don't have a process for notifying health plans of that, and this is being treated similarly to other infectious diseases that are being diagnosed, like measles, influenza, salmonella, anything else that public health works to investigate. And as Shane mentioned earlier, too, as we start to see more community spread, we'll public health control measures change a little bit, and so we will likely be stepping back from some of those quarantine activities into other types of control, like social distancing. We have another question here about which Arizona medical facilities should be considered as centers for excellence to handle identified cases. At this time, we don't have any specific centers of excellence here in Arizona because this presents similarly to a lot of other viral respiratory diseases, including those that can cause pneumonia in individuals with underlying conditions. And we believe that facilities across the state are very well equipped to handle these patients based on other things that they can handle.
Our medical facilities are also required to have infection control systems in place and appropriate staff that can help them facilitate any concerns or issues they would have in order to handle those specified cases.
Great. So we have a question of, do we know how long virus is shed in infected individuals? And this is a great question and one that we all would love to help answer. We don't have a defined, number at this point for the amount of time. So that's something we're certainly all looking to figure out what that might look like.
And one other comment is that the amount of time that a patient is shedding a virus doesn't necessarily equate to infectivity. So our surveillance of looking for shedding doesn't necessarily mean that that patient is infectious to others.
Do you anticipate testing to be available outside of the public health lab? If so, an ETA. So I would say the answer is yes to being available. I unfortunately do not have an ETA for you though, but I do think that there are plans in place right now to help facilitate that.
Our next question is about how long it takes to get test results back. And it can be same day depending on when the specimen is received.
There's a question here. If we have hand sanitizer and it is expired, is it really not effective anymore? Once again, when it comes to those products and as they're manufactured, we recommend that you follow the label and instructions. Just to note, they give those dates, and whether or not they can rely on the integrity of that product to still be effective is in question. So we would say to go ahead and adhere to those recommended dates that are on products.
So how much does testing cost if a patient does not have health insurance? Again, at this time right now, it's only being done at the public health laboratories. And so there shouldn't really be any cost associated with the testing itself.
So there's a question whether or not pregnant women are at increased risk for complications and death, like we had seen with influenza. Like other viral illnesses, pregnant women are considered to be relatively immunosuppressed compared to an otherwise healthy adult. So they are kind of followed for the possibility of increased complications, but the data we've seen out of China doesn't necessarily suggest that's a strong risk factor.
So we've got a question about if there's an individual who might be or might have a compromised immune system, when we would recommend wearing a mask full time. And I think for those individualized patient care questions, we would refer you back to your provider and to have those conversations with your providers. The public health recommendation at this time is that the general public does not need to be wearing a mask, but your own personal sort of questions about your own personal health can and should always be referred back to your healthcare provider.
There's a question about isolation procedures for healthcare facilities when they have a suspect patient. So our current recommendations for isolation are that healthcare workers who have a suspect case employ contact, droplet, and eye protection as soon as possible, and that they isolate that patient as soon as possible in a private room with the door closed. Then again, for specialized aerosolizing procedures, which could include things like intubation or bronchoscopy, that those procedures happen in airborne isolation.
So there's questions around for the one-day turnaround times in the state labs. Is that for presumptive, or does that include definitive from CDC? So that's our presumptive positive results that we are able to produce here at our public health laboratory.
So there's a question about whether if a member calls the plan saying they think they have coronavirus, what do you recommend we tell them regarding getting care? So I would go back to just your standard operating procedure, what you would do if a member calls you. And I think, you know, based on their clinical symptoms, you should refer them to a healthcare provider. Again, you can reinforce that most of these cases are mild to moderate and don't require that a patient be hospitalized, and you can refer them to recommendations for supportive care and how they could take care of themselves at home. But again, as a healthcare plan, I would restrict your recommendations for care to a healthcare provider, and you could refer them to their primary care provider.
Our next question is whether we believe ADHS is being provided with adequate and timely information and support from the federal government to respond. Yeah, we work very closely with the Centers for Disease Control and Prevention on all of our public health responses, and we are in daily contact with them and have been since the beginning of this outbreak.
A question is about whether or not the slides will be available post the session, and they absolutely will. So the links you see on the screen right now will be available to you for your use.
So we are doing our best to kind of disseminate information to all of our partners, whether that's through kind of some of our established systems for communicating with healthcare partners, through the media, and through our website. So, you know, we are doing our best to try to disseminate this information, and appreciate everyone attending and appreciate all your questions.
Definitely, and I think that's another reason why we're going to move forward and post these webinars, recordings, and also the slide sets and make them available through the website that you see on the